Yeah, Alan and Glenda, this is really, really disheartening news as a physician and as a parent, as a dad, right? It's unsettling to see and hear that case numbers for kids have jumped by 40% from July 16th to the 30th. Now, when school was just kicking off, right, in many states. So far, there are nearly 339,000 cases reported nationwide. That's roughly 447 cases per 100,000 children. So that's alarming.
Well, Dr. Nandi, I mean, hearing this as a parent, it's really our worst nightmare, right? This isn't what you want to hear. You know, and internationally, studies are saying that infection rates among school-aged children is low, but that doesn't seem to be the case here in our country. What can you tell us about that?
Yeah, it's always an adventure with COVID, right? I mean, international research tells us that COVID-19 was a low risk for school-age children, but we've got to remember we're in uncharted territory, and the data can and really does change as we learn more. Not to mention that in the U.S., we have the most cases in the world with 5 million confirmed cases, and if case numbers are high in communities, there's a higher chance of just kids getting the virus as well.
So, Doc, what about death rates? Did those numbers increase as well?
So thankfully, Alan, childhood death rates due to COVID are still low. They're considered uncommon, but they do happen, right? According to one report, 86 actually kids have died since May. Most recently, a 7-year-old boy from Georgia with no pre-existing conditions passed away, plus 2 teens from Florida. So it does still happen.
And why do you think this is, Dr. Nandi? I mean, these cases regarding children going up, is it them going back to school?
So Glenda, school hasn't resumed in all states, but we're seeing some cases increase because of it. So for instance, I'm sure you and Alan have heard in Georgia, some schools with reported cases have led to entire classes and teachers being quarantined. In fact, one school had to temporarily close just 1 week after it opened because 6 students and 3 staff members have tested positive. In addition to that, health officials believe that we're just not being as cautious anymore, especially younger folks who think this is not going to affect them.
So, Doc, do you think that the same numbers will rise right here in Michigan when school starts? I know many parents are still on the edge. They're trying to decide what to do with their kids. Should they send them back to school or keep them home?
Listen, Alan, Glenda asked me this, I think, a week ago or so. It's really tough as a parent to decide what to do between online learning or in school instruction. I have 4 kids and 3 of them are in school. It's tough for me to decide, right? And I'm also, like others, concerned about close family members. I have one that I'm pretty positive would not survive a COVID infection. So, but regarding whether or not, the question you asked, whether we'll have more, cases once school resumes, I hope that they won't in Michigan. Because when you compare, for example, Georgia to Michigan, the main difference for us is that, our leadership, and I think we have strong leadership, right? And we believe and mandate that face masks shall be worn. Whereas in Georgia, it's not the case. We have an executive order in place for face masks. So I think this will really help with slowing down the spread of the virus. But for those who are watching and listening, listen, we know what to do, right? We wear face masks, we disinfect, we social distance. That's how we do it. And we teach our kids that so they can replicate our behavior.
All right, Dr. Nandi, thank you so much for joining us. If you have a question or a health concern for the good doctor, you can email him, Dr. Nandi at AskDrNandi.com, or send it to us on Facebook or Twitter, and we'll get it right to him.